Hi everyone, we welcome you all to our dental podcast. With us today we have a renowned gynecologist, Dr. Lavanya Vaitla ma'am, with 20 years of experience. And ma'am is actively been involved with the treating cases and very successful gynecologist. So welcome you ma'am.
Thank you, Dr. Praveen. Actually, you have chosen a very nice topic. Here, there is involvement of both the mother and the fetus, both of which are at stake. So, your practice means a lot, especially when it comes to the dental issues. I am very happy to be on the show. Thank you.
Thank you, ma'am. Ma'am, when we are thinking of a pregnant lady, it's just not the patient, it's the whole family which is involved because of the child, mother, and all those things.
True.
And whenever the patient comes with a dental pain and infection,
Yes.
so there's a lot of things which we have to consider as a dentist. From a gynecology point of view, is the same time that we could operate or do procedures in these patients.
See, doctor, here when we divide pregnancy into 3 trimesters, the first trimester is approximately the first 3 months, the second one is the next 3 months, and the last is the last 3 months. So, optimal time would be somewhere between 14 to 26 weeks, that falls in the second trimester. The reasons being, the first trimester patient has lot of vomitings, nausea, so doing any procedure during that time is a little cumbersome. And also there are the fetal organs that are developing, which we call as the fetal morphogenesis. So during that time, certain antibiotics, certain painkillers are to be avoided. So your treatment becomes a little restrictive in the first trimester. Then when you're coming in the last trimester, when the patient is with a big tummy, seated on a dental chair, sometimes for a long time, sleeping on a reclining position in a reclining chair might be a little uncomfortable. And the second thing, there is something called the supine hypotension syndrome, where the blood pressures tend to fall when the patient is sleeping on her back for a longer time. And considering the hypertension and cardiac issues, they are more common in the last trimester. So all said and done, if you consider these conditions, the second trimester, that means between 14 and 26 weeks, is better for elective conditions, elective surgeries or elective procedures. Being emergency procedures, anytime we can do, taking some precautions.
Yes, ma'am. I think best is to consult the gynecologist, because they will be knowing in and out about the patient's history.
Yes.
And if the patient comes back with a huge swelling or something, then take a consultation from the gynecologist, and the multidisciplinary team approach would be a better way to treat such kind of patients. Ma'am.
Yes. And especially as you mentioned that swelling in pregnancy, see, we have so many conditions. As a dentist, you know better. So the thing is, you have hormones in pregnancy. So these hormones, they do play a major role when it comes to the dental conditions like caries or the plaques and all that.
Yes, ma'am.
So such conditions, I think they should be treated even before.
Yes, ma'am. And one more thing is regarding the medications, ma'am. Because when we prescribe any medications, like especially the antibiotics and analgesics, we as a dentist, we always feel that it's a extra burden or more cautious, to put it in other words. So what the antibiotics or analgesics are safer, and even in the trimester wise also, you would suggest to avoid any antibiotics in specific trimester, ma'am?
Yes, doctor. The thing is, in the first trimester, as I've told you, there is some organogenesis that is happening. So we tend to avoid certain groups of antibiotics like, aminoglycosides. And we have something like, even metronidazole, we don't advise in the first 3 months, though it covers a lot of anaerobic infections. And aminoglycosides like, even tetracyclines, then you have gentamicin, amikacin, then all tetracyclines, we usually tend to avoid. And we, if at all, if possible, try to postpone it to the second trimester. And regarding the analgesics also, ibuprofen, then aspirin is one thing which you have to take care of. Otherwise, acetaminophen and paracetamol are fine. That
Amoxiclav is one thing.
Amox, ampicillin, penicillin groups can be taken.
Yes. Sure. So the next question is regarding the anesthetic, ma'am. Like we basically use lignocaine with adrenaline in most of the cases, and few cases we use a plain LA without adrenaline. What anesthetic agent would you suggest in pregnancies, ma'am? And anything specific you want to add for the last trimester where there is a risk?
The thing is, according to our ACOG and other criteria, lignocaine with adrenaline is supposed to be the drug of choice for dental procedures as an anesthetic. But personally, I feel that when you're coming into the third trimester, we try to avoid adrenaline if possible. But if at all it has to be done, just consult a gynecologist, because she knows better if the patient is a hypertensive or a known cardiac patient. So just with consultation with that, I think you can do, because the main thing that comes up there is the vascularity.
Yes.
They are highly vascular. I know that adrenaline is almost required for you in dental procedures. But keeping in mind the hypertension in pregnancy and cardiac issues, others I don't think it should be a concern.
Okay.
If at all, if possible, I would prefer only plain
LA
okay.
the last
Yes,
trimester.
yes.
That would be safer.
Yeah.
Yes, ma'am. We do use plain LA with the cardiac patients, or at times when we are expecting like medical conditions, we do with the plain LA.
Okay.
I think if possible, then we can just shift to a plain LA only in the last trimester
Yes,
to
yes,
avoid
yes.
the
Yeah.
complications.
First, I think second trimester and all fine. It should be fine.
Yes, ma'am. And sometimes when we extract, there is quite a ooze also.
Yes.
Can we use a topical hemostatic agents,
Yes,
ma'am?
yes.
Does
Topical
that
can be used.
used?
And one more thing I forgot to tell you is, if at all, just we need to just find out if the patient is on aspirin, because hypertensive patients, sometimes we put them on aspirin from the first trimester.
Okay, ma'am.
So that is one thing that's to be. If at all they are on aspirin, aspirin has to be stopped at least 5 days prior to the procedure.
This is a very good information, ma'am, because we always, as a dentist, we only see there's cardiac patients
yes. Now because lot of patients, we have antiphospholipid antibodies positive, Apla syndrome, that's what we call. So we are starting them with low dose aspirin and heparin from the first trimester.
Okay.
So I think that thing has to be stopped.
So to my dental colleagues, so as madam said that, please take a history of aspirin also when you have a pregnant lady who is coming for a dental treatment.
Yeah.
And next thing is this gum infection, ma'am. Basically, the pregnants come with a lot of gum infection, bleeding, and poor oral hygiene at times. And also, what are these impact on the pregnancy as such? Or we have studies which shows that the gum infections or any other infections in the oral cavity have an effect with the low weight on the baby or weight of the baby or something like that.
Yeah.
So, what is your take, ma'am? How do you see these cases in your clinical practice?
Yeah. The thing is, doctor, what happens is, any dental infection is like any other infection in the body. So untreated infections, hidden infections, asymptomatic infections, pregnancy being a condition of low immune condition, sometimes they flare up. So when they flare up, they tend to induce a systemic inflammation in the body. Okay. So that systemic inflammation can indirectly affect the birth weight, leading to low birth weight.
Okay.
And sometimes they even induce preterm labors.
Okay.
So it is ideal to treat them, preconceptionally only.
Okay.
If not possible, at least in the first 2 trimesters, finish up with that, so that they don't end up in preterm labor and premature weight babies, or in fact they even go in for growth restrictions. Even if they go for term, they go for growth restrictions. So ideally it's to be treated beforehand.
So usually this also, I also tell my parents that they usually come, like these couples who come, like they come for a dental treatment. The first thing I also try to tell them that if there's any dental issues, kindly get it treated.
Yes.
Because usually during the pregnancy it becomes a problem, or else sometimes when they are planning a precious pregnancy also, these issues, because they have already been too much focused on that particular aspect of having the baby. But despite of that, I see that the patients also visit to us with the infection and pain.
Yes.
So what is your take on this, ma'am?
See, personally what I feel, doctor, is that if a patient is going in for preconceptional counseling, a dental appointment is also a must now. Why? Because many conditions which are hidden, asymptomatic, or in the preconceptionally, they suddenly tend to flare up because of hormonal issues, because of vascularity, whatever it is. So then, the dentist's hands are tied up.
Yes.
So other than emergency procedures, elective procedures are avoided.
Yes.
So what we suggest, and preconceptionally only, take an appointment, get a dental checkup done. In case X-rays are required, take them done, because maybe later on you'll have to use lead shields and thyroid shields and all that. So get an examination done. If it's a simple cleaning and all, get it done prior. Any abscess, any extractions, finish it up. So one more thing is, With regard to the oral hygiene, I think you are the best person to advise them preconceptionally how to maintain oral hygiene and all that. Brushing twice a
Yes,
day, and you're cleaning the scales or whatever, the
Yes,
plaques and all beforehand. Instead of postponing it to last trimester, and then instead of landing up with any emergencies and
so
all
this
that.
is one more issue when they will come and tell that I have a baby, I'm pregnant, I'm not able to eat, I'm not
Yeah.
able to chew, because
Yes.
even the sweet, when it triggers the pain.
Yes, yes, yes.
So what they think is just a tooth, but when they're not able to have a good food, and
Good
it
food.
indirectly affects
Yes.
the entire
Yes.
body also,
Yeah,
in
and
terms
that,
of immune
especially
system.
with the sweet cravings and all they
Cravings.
have, they tend to munch in at odd times.
Yes, ma'am.
So
They
it's
come.
always
A
better.
lot of patients you do refer to me. Then when they come with it, then we
Yes,
tell that
yes,
okay,
yes,
fine,
yes.
just postpone it until
Yes, yes.
you deliver. If it is not emergency, then we tend to just postpone it, ma'am.
Yeah.
So this is an take-home message even for the patients that get a thorough evaluation done before you plan a pregnancy, so that you don't have to suffer during the pregnancy. As
And-
madam mentioned, because of hormonal issues,
Yes, yes.
there will be some problem.
Yeah, and one more thing to add, I think if when they come to you for a dental consultation in the preconceptional thing, we would also advise them to have certain, something calcium rich food and, proper diet, vitamin C, vitamin D supplements and all that.
Yes, ma'am.
So we would add, and from your side, if you can do it, it would be even better
Yes,
for
ma'am.
us.
Sure,
Yeah,
sure,
that's why.
definitely,
Yeah.
ma'am. And now with these younger population, ma'am, like these adolescent patients, the girls who comes to us, we see these hormonal related issues, and there's a lot of gingivitis, like puberty gingivitis or something like that. And even with the PCODs patients also, we see certain oral changes. But most of us, what we do is we do a scaling, then we prescribe them some mouthwashes and ointments, and we do send.
Okay.
So I at times make a referral to a gynecologist,
Yes,
and then
yes,
we find
that's
out
right.
that there is an hormonal issues.
Yes, yes.
So how often you get such kind of cases, ma'am, or what is your take on?
Yeah, because now that PCOD is on the rise, and we know that it's a lifestyle disease. So, and we also have patients from, North Karnataka, where they're used to using tobacco, chewing tobacco, and I don't know, that nasi and
Yes,
all that,
ma'am,
they
yes,
have
ma'am.
that. So when a patient comes to me from your side, we tend to give them a diet chart, maintain a proper lifestyle, avoid these sweet these things and all that, so that their dental part is taken care of. And in the process, it even helps them, as a preconceptional care for pregnancy. That goes both way actually.
Okay.
And the second thing is, in a pregnant patient also, I think it should be made mandatory for a dental checkup for the same reason, for their addictions and all that. We are seeing even alcohol consumption is still going on
Okay.
among females in North Karnataka.
Okay.
In North Karnataka. No, it's not surprising
Yes,
actually.
ma'am.
So all said and done, I think in collaboration with a dentist, it would be better if preconceptionally all these are tackled.
Okay. Thank you, ma'am. Thank you for the podcast. And a lot of take-home messages were there for the
Yeah, my
dentist
pleasure.
also, ma'am.
My pleasure.
And it will be definitely a very useful podcast. And
Yeah.
we thank you for being part of it and
Yeah.
accepting the invitation
Yeah.
to for your time as well, ma'am. Thank you. Thanks
Thank
a
you.
lot.
Thanks a lot.